I'm Ingrid Plunkett, and I'm the psychiatric social worker at the Mid-Coast Senior Mental Health Department. We know that aging well depends on your genes, your environment, and your lifestyle. And actually, we're coming to know that healthy lifestyle choices are helpful in maintaining a healthy body and brain. There are possible risks or threats to brain health. Some medicines or improper use of them, smoking, excessive use of alcohol, which we'll tie into later with the grant study as well, heart disease, diabetes, and other health problems, poor diet, insufficient sleep, lack of physical activity, and lack of little social activity, and being alone most of the time. These are all risk factors and threats. So what can you do to protect brain health? Actions that can help: obviously taking care of your health with your primary care doctor, eating healthy foods, being active, learning new things, connecting with family, friends, and community, that isolation piece, and working to really prevent that. So, getting recommended health screenings, managing health problems like diabetes, high blood pressure, and high cholesterol, very important for brain health. Regular review of your medicines. When you see specialists, when they change your medicines, bring those to your primary care doctor and to your specialist and vice versa. Reduce risk of brain injuries due to falls and other types of accidents. Quit smoking. And eating healthfully. Fruits and vegetables, whole grains, lean meats, fish, poultry, low-fat or non-fat dairy products, less solid fat, sugar and salt, proper portion sizes, and adequate fluids. There is evidence that this really makes a difference in terms of overall health and aging. A big one is get moving. And we find that in both the cognitive aging book and also the grant study of adult development. Physical activity can really improve connections among brain cells. It also reduces risk of diabetes, heart disease, depression, and stroke. It helps prevent falls. And so it's a hard one. But finding a way to get at least 150 minutes of exercise each week is really a goal to strive for. Moving about 30 minutes on most days. And walking is always a good start. Also checking with your healthcare provider about other ideas. There are Silver Sneakers programs throughout the area. And finding that kind of group activity can really invigorate not only your physical health, but your social connections as well. When the study began, nobody cared about empathy or attachment. This is the George Ballant who conducted the study from 1972 and 2000 and has published 2 books about his involvement with the study for those years. But the key to healthy aging is relationships, relationships, relationships. The other 6 factors that he really identified were physical activity, absence of alcohol abuse and smoking, having mature mechanisms to cope with life's ups and downs, and enjoying both a healthy weight and stable relationships. When we're older adults, we're generally in retirement, although people are working later and later in the United States. So something that Dr. Waldinger, who's the current researcher in charge of the grant study on adult development, looked at what are the ingredients of happy retirements among this cohort of men. And the first one was to replace workmates with other social networks. So volunteering and building those social networks is productive and predictive of more satisfying mental health. Learning something new, trying something new, that's good for us. Engaging in creative endeavors, photography, dance, yoga, painting, pottery, and learning new things. So people who have meaningful activities like volunteering say they feel happier and healthier in their 70s, 80s, and 90s. Social activities are linked to reduced risk for some health problems, including dementia. And keeping your mind active. Both the Harvard study and the cognitive aging study show us that doing mentally stimulating activities, reading books and magazines, playing games, taking a class at the senior university, teaching a class, learning new things, auditing a class at Bowdoin College, which community members are allowed to do. So just being social through volunteer work, just through your personal work, your hobby work. These are good for your overall health. So what can you do today? So I think picking one thing you can do that may help your brain, just even starting with small first steps, like adding a 10-minute walk a few times a week, one serving of vegetables each day, or making an appointment for a health screening or physical exam so that you can review your medications. And write down what you will do and when. Finding accountability partners to make positive changes and starting new things. Very important. And just getting that support from family, friends, or community groups.